some of the things you may experience following treatment. It will give you a guide to staying safe at home and make sure you know when you need to ring the hospital for advice.
Chemotherapy and radiotherapy are types of treatments used to kill cancer cells. Both of these treatments have other effects on your body, and these are known as side effects. Side effects happen because these treatments can kill healthy cells as well as cancer and leukemia cells.
Chemotherapy and radiotherapy can affect everyone differently. No two people are the same. Some people only have a few side effects and others can have quite a lot.
Some effects are known as long-term effects and may develop over time. Your consultant will discuss these with you. Most side effects are short-term, which means your body will recover from them completely when your treatment is over. This film will focus on these. Short-term side effects can sometimes make you feel very unwell. You must let your hospital know if you experience them.
First, let's talk about how treatment affects your bone marrow. Bone marrow is like a factory where the body makes all the different cells that make up your blood. There are 3 main types of cells in the body which all have important jobs to do.
Red blood cells, which can also be called haemoglobin, help you keep active. They carry oxygen around your body. Following treatment, if red cell levels are low, you may look pale and feel tired. You may also have headaches, aching arms and legs, or feel short of breath.
If you notice any of these things, you need to ring the hospital. This is called anemia and you may need a blood transfusion.
Platelets are cells that help clot your blood when you bruise or cut yourself. If your platelet levels are low, after treatment you may find that you bruise easily or you have a rash that looks like pinpricks. You may get nosebleeds or your gums might bleed when you brush your teeth. You might notice blood when you use the toilet or if you are sick. Girls may experience long or heavy periods. All of these things are signs that your platelets may be low, so ring the hospital as you may need a platelet transfusion.
White blood cells fight infection in your body. Treatment can affect particular white cells called neutrophils, which are especially important. If neutrophil levels are low, then you are much more likely to become unwell with an infection.
Spotting infection is very important. Use your thermometer to take your temperature in the morning and again at night before bed. You should also take your temperature anytime you feel unwell. Your thermometer needs to be like your mobile phone. You wouldn't leave the house without it.
A normal temperature is usually between 36 to 37. A temperature of 38 or higher means you must ring the hospital straight away. You'll need to come into the ward so we can check you over. You might need to stay in, so don't forget your suitcase. Only take paracetamol if you have called the hospital and we've told you it's okay.
Sometimes a low reading of 35 or lower may be a sign of infection. Recheck your temperature immediately and ring the hospital if it reads low again.
Other things to look out for are shivering and feeling very cold, cold hands and feet that look mottled like corned beef. Even if your temperature is okay but you feel unwell, then ring the hospital for advice.
Most teenagers need to drink a fair bit in a day, about the same as 3 to 4 small bottles of water. This is very important for a few days after treatment, as your kidneys help your body deal with the chemotherapy. Very rarely you might be asked to drink a much lower amount, but you would be given clear instructions before going home.
Keeping a healthy weight is important as it can help you fight infection and allow your body to repair and rebuild when having treatment. Sometimes though, it can prove tricky as food may taste different, swallowing and digesting food may be hard. You may be sore or just not feel hungry. Eating smaller meals more often can help, and high energy drinks or milkshakes are a good way to keep you going when eating is hard. The ward dietitian will support you more closely if eating becomes a bigger challenge.
Sometimes chemotherapy and radiotherapy can give you a sore mouth or throat, which is known as mucositis. If you notice mouth ulcers or cold sores, then ring the hospital. If your mouth is sore or bleeding and stops you from drinking and taking your medicines, then you must let the hospital know.
Often you can take painkillers and mouthwashes to help, but sometimes you may need to stay in hospital for a little while to make you more comfy. To look after your mouth, use a small soft toothbrush to clean your teeth after meals and at night. If you need to see the dentist, then check with your consultant, as they may advise that you see a dentist from the hospital.
Feeling sick is something that chemotherapy and sometimes radiotherapy can cause. Lots of medicines help with this, and the hospital will work hard to find the right ones for you. Try sipping water or sucking ice cubes to make sure you get plenty of fluid. If you are feeling sick or being sick a lot at home, then ring the hospital for help, especially if it's stopping you from eating, drinking and taking your medicines.
Some medications can cause constipation. You might find it a bit embarrassing to talk about this, but let your doctor or nurse know, as they'll be able to give you some ideas to help.
Diarrhea is another thing to look out for. It may be due to an infection and can leave you pretty worn out, so let the hospital know so you can get put back on the right track and start feeling better.
You normally have a balance of good and bad bacteria as part of your body's way of keeping healthy. Sometimes treatment upsets this balance and can make you unwell. Washing daily and good hand washing before eating or after using the toilet is important. If anywhere on your body hurts or doesn't look right, even in the very private parts, then it's safer to let your hospital know.
Sun safety is especially important after chemo or radiotherapy. Slap on the total sunblock,
Grab a hat,
cover up and stay in the shade.
be safe, don't sizzle.
One of the most challenging things about having treatment is that you can lose your hair. It begins to fall out gradually and usually takes 2 to 3 weeks. The hair on your head and the hair on the rest of your body can also be affected. Some people decide to use hats or caps when this happens. Others choose scarves or bandanas.
If you choose to use a wig, this can be sorted quite quickly. It can be matched to your own style and colour, but you might want to experiment a bit and choose something completely different.
The hospital staff can help you out with whatever you decide, and you can often get good ideas and tips from other teenagers on the ward. Almost everyone finds that their hair grows back when treatment is over. It may grow back a little differently. It may even be a different colour. There's a lot to get your head round, but the hospital staff can help with any questions or if you just need a chat.
Your views and opinions are important in the decisions about your treatment and care. You can expect privacy, respect and confidentiality.
The unit welcomes your family and friends if you choose to have them with you throughout your treatment.